Thousands of children are born each year with a birth defect called microtia. It's an ear abnormality that often goes undetected in ultrasounds.
A San Antonio surgeon is doing some pretty incredible work correcting these deformities. Medical reporter Wendy Rigby joins us with that story. Wendy?
Most of these children have small, abnormally shaped ears, but their hearing is also affected. That's why it's so important that it be corrected. Microtia occurs in 1 in every 6 to 12,000 births. It mostly affects boys on the right side. Many of the children suffer emotional trauma, and this cosmetic surgery dramatically changes their lives. We should warn you, this story contains some graphic surgical video. 10-year-old Andrew Lamica is getting ready for the second of 4 surgeries to correct his microtia. He's endured questions about his appearance for years.
They used to tease me about my ear and all that other stuff, and I just wanted it because I didn't want this to stop the teasing.
Last year, it's when it, I think, got to him, and he said, when am I going to have surgery? I want surgery. And that's when it dawned on me where, yes, okay, I have to find out something. I got to do something.
During that first surgery, doctors took cartilage from Andrew's rib cage in a procedure like this. Dr. Arturo Bonilla uses a YAG laser to cut the tissue he needs to shape the ear. He says using a piece of the child's own body is better than a prosthesis, since it grows along with the body and has a better chance of staying in place for life.
The goal of all this is to be able to drill through the bone in his skull to get to his middle ear, to make him have some hearing, to help him with the hearing. The little child we're doing right now is actually affected on both sides, so she has no hearing on both sides.
Dr. Bonilla must match the size as closely as possible to the size of the other ear. While there's no proven cause for microtia, some theories include medication side effects or environmental effects. Today, Andrew is looking forward to a whole new look.
I'm looking forward to having a better haircut. And I want a buzz cut. A buzz cut. A navel haircut.
Each procedure takes 4 to 5 hours. Dr. Bonilla will be performing several hundred of these surgeries over the next 5 years. He's not only restoring hearing, he's restoring lives. Since the last time we talked to Andrew, surgeons have completed his new ear, and here is what he looks like now. Andrew is just one of the hundreds of patients Dr. Bonilla has operated on. These children come from all over the U.S. and Mexico here to San Antonio to have this procedure done. And Dr. Bonilla says it's gratifying to see these children go from shy to self-confident simply on the basis of this one minor change in their appearance.
It looked pretty good.
Looked pretty miraculous.
It's interesting. The biggest compliment to this doctor is if you don't notice his work.
That's right.
Because he just looks like another kid now.
That's right, a happy kid.